If you're here, you are likely facing one of the hardest moments of your life. Maybe you're caring for a parent, a partner, or a friend, and you're trying to hold it all together. This isn't just a guide. It's a lifeline. In the next few minutes, I'll walk you through how to care for your loved one physically, emotionally, and spiritually, while protecting your own heart and health. You are not alone. And yes, you can do this. With love, with strength, and with support. Let's get into it. Palliative care. It's a phrase you may have heard, but not fully understood, until now. Let's be clear from the start. Palliative care does not mean giving up. It means choosing comfort, dignity, and peace of mind, for your loved one, and for yourself. It's a type of care designed for anyone facing a serious or terminal illness. And its main goal, to relieve suffering, whether it's physical pain, emotional stress, or spiritual distress. Unlike treatments that focus on curing the illness, palliative care focuses on something equally important: quality of life. It can begin at any stage of illness, not just in the final days or weeks. In fact, the earlier it starts, the more support it can offer. And it's flexible. Palliative care can be provided in hospitals, hospices, nursing homes, or right in the comfort of your own home. But here's what makes it truly powerful. It treats the whole person, not just their symptoms. That means managing pain, but also helping with anxiety, depression, spiritual questions, and family struggles. It brings together a team of nurses, doctors, social workers, and chaplains, all working to support not just the patient, but the entire family. Because in palliative care, love is part of the medicine. This is about helping your loved one live as fully and comfortably as possible, for as long as they have. So if you've been scared that accepting palliative care means the end, it doesn't. It means choosing compassion, clarity, and care. And you don't have to walk that path alone. When you're caring for someone who's terminally ill, it's easy to feel overwhelmed, like you have to do everything, all at once. But here's a secret: you don't have to do it all. You just have to focus on the core. Palliative care is built on 4 foundational pillars, the big 4 you'll be supporting every day. First, there's physical relief. That means helping manage the pain, fatigue, nausea, shortness of breath, the body's way of calling for help. You'll work with doctors and nurses to adjust medications, reposition the body, and ease discomfort. And every time you fluff a pillow or offer a sip of water, you're giving relief. You're giving care. Second, emotional comfort. When someone's facing the end of their life, emotions often flood in: fear, anger, regret, sadness. That's okay. It's normal. Don't feel like you have to fix it. Just be present. Listen. Hold their hand. Let them cry. Let yourself cry, too. Remember, connection is medicine, too. Third is spiritual peace. This looks different for everyone. For some, it's faith. For others, it's reflection, meaning, or simply silence. Ask gentle questions. What's on your heart today? Is there anything you'd like to say or hear before you go? Help them find closure, if they want it, or simply sit in the mystery with them. Number 4, family and caregiver support. And finally, the often forgotten pillar, you. Palliative care is not just for the person who's ill. It's for their loved ones, too. You're carrying a heavy emotional load. You may be grieving while still caregiving. That matters. Your mental health, your rest, your boundaries, they matter. Ask for help. Accept it. You are part of the care plan. So when you feel lost, come back to these 4: the body, the heart, the spirit, and the family. That's where the real healing lives. That's what palliative care is all about. You're not just helping someone die. You're helping them leave. With comfort, with meaning, and with love. Physical care is one of the most immediate ways you can love and support your terminally ill loved one. And no, you don't need to be a nurse to do it well. You just need to be attentive, gentle, and willing to learn. The goal isn't perfection, it's comfort, it's safety, it's helping them feel human in a body that may no longer cooperate. Step 1. Follow medication instructions carefully. If your loved one is on pain medications, opioids, patches, or liquid morphine, make sure you're following the instructions exactly as prescribed. Never skip doses, and don't hesitate to ask questions. If something feels off, if they're more confused than usual, or the medications aren't touching the pain anymore, reach out to the doctor. You are allowed to advocate. You are supposed to advocate. Step 2. Keep a daily log. A simple notebook or phone app can become your best tool. Track symptoms, pain levels, appetite, sleep, side effects. Patterns help providers fine-tune treatment. And when you're sleep-deprived or overwhelmed, the log becomes your memory. Step 3. Partner with their medical team. You are not alone. You don't have to guess and Google everything. Stay in touch with hospice nurses, palliative care doctors, or your loved one's primary provider. If something changes, if they stop eating, if their breathing changes, if they wince when moved, report it. Even small changes can matter. Step 4. Comfort beyond medicine. Pain isn't just physical. There's emotional pain, tension, anxiety, and your presence is powerful medicine. Gently massage their hands, neck, or feet. Use warm blankets, soft socks, and cool washcloths. Play calming music or white noise. Let natural light in during the day, and dim lights at night. Keep familiar scents nearby. Lavender, or a favorite lotion. These little touches can mean more than any pill. Pro tip. Comfort is more important than appetite or appearance. Let go of the idea that they have to look okay, or eat enough. Toward the end, the body naturally begins to slow down. Forcing food can create more harm than help. Trust their cues. Let comfort lead. At this stage, you're not treating a disease. You're caring for a person. A whole person. And every small act of relief you give is an act of love. You are creating a space where your loved one can rest, let go, and feel safe, right to the very end. One of the most important ways you can show love and dignity to a terminally ill loved one is by helping them feel clean, safe, and physically supported. As the body slows down and mobility fades, your role becomes more hands-on and more sacred. Let's walk through how to keep your loved one comfortable, prevent complications, and protect their sense of dignity. Repositioning every 2 hours. First, if your loved one is mostly in bed or a chair, reposition him at least every 2 hours. This helps prevent pressure sores, also known as bed sores, which are painful, dangerous, and very common at the end of life. Gently roll or shift their body with support, using a draw sheet or folded blanket under their hips and shoulders. Try not to drag their skin. Lift and adjust with care. You're not just moving their body. You're protecting their comfort and their skin, which becomes fragile with time. Use pillows for support and elevation. Pillows are your best friend. Use them behind the back, between the knees, under the ankles, anywhere that needs cushioning or support. For breathing comfort, elevate the head slightly with pillows or an adjustable bed. For circulation, place a small pillow under the knees or lower legs. Each body is different. Experiment gently to find the position where they can relax. Hygiene. Bed baths with dignity. Next, hygiene. Even if your loved one can't get out of bed, they still deserve to feel clean and respected. Offer a gentle bed bath daily or every other day. Use warm water and a soft cloth. Wash one area at a time and keep them covered with a towel or blanket to preserve warmth and modesty. You're not just washing their body, you're honoring their personhood. Go slowly, speak gently, let them know what you're doing before you do it. Daily mouth, eye and lip care. Even if they're not eating much, dry lips, sticky mouths, and irritated eyes can cause a lot of discomfort. Moisturize the lips with balm. Gently swab the inside of their mouth with a moistened sponge. Use a soft cloth to clean their eyelids. These tiny gestures have a big impact. They reduce pain, soothe the senses, and help your loved one feel seen and cared for. Create a comfortable environment. Finally, take a moment to check the room itself. Is there natural light during the day? Is it too hot or cold? Are there tripping hazards or clutter around the bed or chair? A clear, calm space supports a clear, calm body. Add small comforts. Their favorite blanket. A family photo. Fresh air. Familiar sounds. Every movement, every touch, every washcloth and pillow. It's not just care. It's love, in action. You don't need fancy equipment or clinical training. You need patience, gentleness, and the reminder that what you're doing matters deeply. One of the hardest things to watch as a caregiver is when your loved one stops eating the way they used to. You may find yourself begging them to eat, worrying they're wasting away, and feeling helpless as you watch their appetite fade. That fear is valid. That grief is real. But here's what every caregiver deserves to hear. Loud and clear. Let them lead the way. When someone is nearing the end of life, their body naturally starts to slow down. Digestion changes. Hunger fades. Thirst may disappear altogether. This isn't them giving up. It's the body transitioning. Gently, gradually, and in its own time. Offer. Don't pressure. Your job isn't to push or force. It's to offer comfort. Think small. A spoonful of soft mashed potatoes. A few sips of warm broth. A taste of their favorite pudding. If they say no, that's okay. If they want only a bite or a sip, that's enough. Honor their choices. Respect their rhythms. Let food become an offering, not an expectation. Hydration for comfort, not necessity. At this stage, hydration is often about comfort, not survival. Ice chips, sips of water through a straw, or moist swabs can soothe a dry mouth. Use a damp sponge to gently moisten the lips and gums. Apply lip balm often. Keep their mouth clean. It makes a huge difference in how they feel. Watch for swallowing changes. As their swallowing weakens, it's crucial to monitor for signs of difficulty. Coughing while eating, a wet-sounding voice, or food staying in the mouth. If you notice these, stop feeding and talk to a nurse or doctor. Aspiration, when food or liquid goes into the lungs, can be dangerous. Support without stress. What matters most is not calorie counts or portion sizes. What matters is that they feel safe, respected, and loved. Let go of the pressure to get him to eat. Instead, sit beside them. Offer small comforts. Wipe their mouth gently. Hold their hand. Support them without stress. Let food be about connection, not control. Pro tip: comfort is the goal, not the plate. You're not failing if they stop eating. You're not doing it wrong. You're doing something sacred, helping them feel peace in their body and dignity in their final days. Trust their body. Trust your care. Let love be the nourishment now. When someone you love is dying, you may feel pressure to say the right thing. Do the right thing. Fix what hurts. But in moments like these, the most powerful gift you can give is you. Your calm presence, your steady hand, your quiet love. Your presence is the most powerful medicine. You don't have to force conversation. You don't need the perfect words. Just be there. Sit quietly. Hold their hand. Put your phone away. Let them know, with your stillness, that they are not alone. Because often, the greatest healing doesn't come from doing. It comes from simply being. Invite memories, gently. If they're awake and alert, invite him to share memories. Ask about the life they lived. What was your happiest day? Or, what's something you never told me before? These conversations aren't just comforting. They're legacy. They help your loved one feel seen, heard, and remembered. Use the power of the senses. For many, senses become more important than words. Play soft music from their favorite decade. Diffuse a gentle scent, like lavender or vanilla. Let them feel a familiar blanket or photo album in their hands. These small, sensory touches create safety and warmth, even when communication is difficult. Say what they need to hear. There may come a time when they can't speak much at all, or not at all, and in those moments, say the things they need to hear the most. Repeat softly, I'm here. You're safe. You are deeply loved. It may not seem like much, but those words land in the heart. Even when the body is fading, silence is okay. Listening is healing. If they're quiet, follow their lead. Don't fill the space. Your silence says, I'm not afraid to be with you. Even in this, you don't have to be strong all the time. You don't have to pretend this isn't hard. Showing emotion isn't weakness. It's connection. What your loved one needs most is presence over perfection. Your willingness to stay. Through the awkwardness, the fear, the tears. That's the healing. In the end, what we all want is the same. To be held, heard, and remembered. You are giving him that. And that is everything. When someone is facing the end of life, their questions often go beyond the physical. It's not just about pain or medication anymore. It's about peace. Meaning, closure. The spiritual side of dying is deeply personal, and just as important as any medical care. And here's the truth. You don't have to be religious, or have any answers, to help someone find peace. Help them find peace, in their own way. Spiritual support isn't about preaching. It's about presence, about listening for what matters to them, not what you think they should believe. Start by asking simple, open-hearted questions. What brings you peace? Is there anything you want to say, or hear, before you go? Would you like me to pray with you, or just sit with you? Honor their rituals, faith or not. For some, peace comes through faith. Prayer, scripture, last rites, or quiet moments with a chaplain. For others, it's the sound of rain, a favorite poem, birds outside the window, or the warmth of a candle. If they ask for something, music, a mantra, a meditation, honor it. Even if it's not what you would choose for yourself. Create a peaceful environment. Create calm around them. Dim harsh lighting. Light a candle or open a window. Play soft music or nature sounds. Use essential oils like lavender, if they enjoy it. Let the space feel sacred, whatever that means for them. Encourage forgiveness and closure. At the end of life, people often carry emotional weight. Regrets, guilt, unspoken goodbyes. If they open that door, gently walk through it with them. Encourage forgiveness, whether it's forgiving others or themselves. Let them know it's okay to let go. This is often the greatest relief you can help give. Not just in the body, but in the soul. Respect their beliefs, even if they're different from yours. This isn't about you. This is about helping them feel whole. Whether their path is prayer, poetry, or pure silence. Walk beside them with compassion, not correction. Dying is a sacred passage, and spiritual support doesn't require answers. It requires presence, curiosity, respect. By honoring what brings your loved one peace, even if it's different than your own beliefs, you're giving them the freedom to die as they lived, authentically, and surrounded by love. In their final days, you have the power to help them feel at peace, not just with the world, but with themselves. When someone we love is dying, it's easy to focus only on comfort, medications, and logistics. But there's something else, something beautiful, that can also happen in these final days. Legacy. Even when time is short, there's space for meaning, for reflection, for leaving something behind. Give space for legacy, something to leave behind. You don't need a grand plan or a production crew. Legacy can be simple, honest, heartfelt. Sometimes it's a quiet conversation at the bedside. Other times, it's writing down a family recipe, or recording a few final words. Whatever the form, legacy helps your loved one feel like their life mattered, and will continue to matter after they're gone. Record voice notes or video messages. Offer to help them record a message. For their kids, their partner, or the generations they may never meet. A voice memo, a short video, even a handwritten note. These become treasures that can comfort, guide, and connect families for years to come. You might ask, is there anything you'd like to say to the people you love? What wisdom would you want your grandchildren to hear one day? Don't worry if it's not perfect. Let it be real. Let it be them. Create a memory book together. Another simple but powerful idea is to create a memory book with photos, stories, favorite songs, or quotes. Let them share their milestones, their values, the silly moments they never want forgotten. This is legacy in its most human form. Not just who they were, but what they loved. Ask the right questions. Sometimes, people just need a gentle invitation. Try asking, what do you want your family to remember most about you? Is there anything you still want to say or do? Are there any stories you want us to carry forward? These questions can open the door to connection, healing, and deep peace. Let them pass down their voice. When a loved one is dying, they're not just saying goodbye. They're also handing something over. Their voice, their story, their love. Give them the space to pass it on. It may be messy, emotional, or quiet, but it will be real. And it will last. Legacy doesn't have to be big. It just has to be true. You may never forget how they held your hand. But one day, you'll be glad you helped them leave behind their words, their laughter, their truth. In the end, legacy is not about death. It's about life. And the way we help someone share theirs, even in the final days, is one of the greatest honors we'll ever know. If you're caring for someone who's dying, there's something you may not hear often enough. You matter too. You're showing up every day. You're answering middle-of-the-night calls. You're managing medications, emotions, meals, often at the expense of your own sleep, your own health, your own peace of mind. But here's the truth. You can't pour from an empty cup. Your loved one needs you. Not a perfect version of you, just you. And that means preserving your strength, your spirit, and your sanity wherever you can. Accept help. Yes, really. If someone offers to bring a meal, say yes. If they say, let me sit with them so you can get some rest, say yes. This is not a time for pride. It's a time for community. You were never meant to do this alone. Take 15 minutes a day just for you. Even a few minutes can help you reset. Step outside. Breathe fresh air. Journal. Stretch. Cry if you need to. Sit in silence with a cup of tea. Those 15 minutes aren't selfish. They are survival. They are self-respect. Join a caregiver support group. No one understands the exhaustion, guilt, love, and grief quite like another caregiver. Whether online or local, support groups remind you, you're not crazy, you're not failing, you're just human. And you are doing something incredibly hard. Speak honestly about what you feel. You don't have to be stoic. You don't have to pretend you're fine. Say it out loud. I'm overwhelmed. I'm scared. I don't know if I can keep doing this. Speaking it doesn't make you weak. It makes space for healing. Eat, rest, hydrate, repeat. These are the basics, and they still matter. Eat real food. Even if it's simple. Drink water. Let yourself rest without guilt when the opportunity comes. You are not a machine. You are a person walking through one of life's most sacred and hardest seasons. You are doing your best. That is enough. And even when you feel like you're not doing enough, the truth is, your presence is everything. You're holding someone else's pain, fear, and vulnerability. But you don't have to lose yourself in the process. Give yourself grace. Forgive yourself often. And when the day ends, remember this. Caregiving is love in its rawest form. And it's okay to love yourself through it, too. When you're caring for someone who is dying, it can feel like the loneliest journey in the world. Long nights, silent fears, the ache of watching someone you love fade. But here's the truth. This is not unique to you. Thousands of others have walked this path before you. And though each journey is different, the heart of it is the same. The following are real voices. Real caregivers. Real moments from real people who sat where you're sitting now. Caring for my mom taught me more about love than anything else ever could. It wasn't perfect, but it was pure. It was the hardest thing I've ever done. And the most meaningful. I doubted myself every day, and yet I'd do it again in a heartbeat. We laughed. We cried. Sometimes we said nothing at all. But in those final days, there was peace. Even in goodbye, you may not feel strong, but you are stronger than you think. You may feel like you're failing, but your love is making all the difference. You may feel invisible, but right now, you are doing sacred work. Every act of care is an act of love. You're not alone. You are part of a quiet, powerful community of caregivers. Let their words hold you up when you're tired. Let their stories remind you. This pain has meaning. This love has weight. This goodbye can hold beauty. You're doing the work of angels. Even when it doesn't feel like it. And you are not alone. Let's be honest. Caregiving is not something most of us are trained for. You're suddenly expected to become a nurse, a counselor, a medication expert, a spiritual guide, and an emotional anchor, all at once. And many of you are doing all this on top of jobs, children, or grief of your own. So let's be clear, you don't have to do this alone. There are free, trustworthy resources out there to help you feel more confident, supported, and less overwhelmed. Every step of the way. 1. Download Daily Home Palliative Care Checklist. This printable checklist breaks down what to monitor and how to help, day by day. From pain management to mouth care, hydration, repositioning, and when to call for help. It's all in one place. Use it as a guide, or just as a quiet reminder that you're doing what matters most. 2. National Hospice and Palliative Care Organization, NHPCO. This organization is a goldmine of accurate, up-to-date, and compassionate information about end-of-life care. From how to find local hospice services to understanding your rights as a caregiver, their website has tools, videos, and answers to questions you didn't even know you had. 3. Grief and caregiver support helplines. Sometimes, what you need most is simply someone to talk to. Someone who gets it. There are national hotlines and non-profit grief organizations that offer emotional support, not just after your loved one passes, but during the journey as well. These are not crisis lines. They are lifelines. 4. Local palliative nurse finder tool. If your loved one is still at home, and you're feeling unsure, don't wait until it's urgent. Use the nurse finder tool we've linked to find a local palliative nurse or home hospice team. They can help manage symptoms, answer your questions, and, more than anything, help you feel less alone in the care. You are already doing something incredibly brave by showing up for someone you love. But you don't have to carry it all alone. There is help. There is community. There are tools that can make this lighter, even just a little bit. And when you take one small step toward support, you're not just helping them. You're protecting your own heart, too. If no one's told you lately, this is sacred work. What you are doing, quietly, lovingly, often behind closed doors, is love in its purest, rawest form. You're not just giving care. You're offering dignity, comfort, presence. You're helping someone feel safe, even as their world is changing. Not because it's perfect, not because you always know what to say, but because you're still showing up. You're showing up tired. You're showing up scared. And still, you're there. And that is what makes this sacred. This is love in action. In whispered reassurances. In warm blankets. In the silence between breaths. In the moments where no one sees what you're doing, and yet you keep doing it anyway. It's okay if you feel overwhelmed. It's okay if you feel like you're breaking inside. That doesn't make you weak. That makes you human. Even when it's messy, even when you're exhausted, even when you doubt yourself, you are making a difference. This is love in action. You are doing sacred work. One day, when you look back on this season, you won't remember every task or detail. But you will remember that you showed up. With courage, with grace, with love. And if your loved one could say just one thing to you now, it might be this: thank you. I felt your love. I wasn't alone. That's the legacy you're creating. Not just for them, but for yourself. So take a breath. You're not alone. And you are enough. If this video gave you clarity, comfort, or just a little peace, don't keep it to yourself. Share this with another caregiver who needs to hear, you're not alone. Tap like if even one part of this helped you today. Drop a comment. Your story, your tip, or even just your loved one's name. Let's build a community of care. Share this with someone walking this journey. It might be exactly what they need. And if you want more support, guidance, and real talk on caregiving, hit subscribe. You are not alone. And you never have to do this alone again. You're doing sacred work. And you're doing it beautifully. Thanks for watching. I will see you in the next video.